Welcome, my deep roots with Niger Babe in Texas audience. Thanks for being part of this podcast family of ours. I truly appreciate it. Today I have a special guest, Dr. Funsho Akinluyo, for this episode, and our goal is to provide an overview on dental care and share the importance of being proactive with our dental health. Dr. Akinluyo is a dental surgeon in the Virginia, D.C. area in the U.S. and works at Nibar Dental Care in Virginia. Dr. Funsho received her education from Nigeria, UK, and the US. She and I are good friends. We both went to high school together, so I am excited and looking forward to having her on this podcast. We do plan on having future episodes on dental care, therefore please stay tuned to these podcasts. Thank you. This is something we've been working on for a little while, so we get to have you on my podcast.
I'm, I'm honored to be here. Thank you. Thank you for having me. Like I said before.
Thank you. All righty. So Dr. Funsho, if you can give us, our audience, with our names, all of our names mean something, right?
Mm-hmm.
So my first question to you would be, what does Funsho mean? And is Funsho the full name? Or, like my name means, Ogechi means God's time is the best. What
Mm-hmm.
does Funsho mean?
Okay, so you're right. Most Nigerian names have meanings. Almost every Nigerian name has a meaning. And Funsho is the short form of a much longer name. The full name is Oluwa Fumisho, interpreted to mean given by God to be looked after.
Oh, wow. Wow. I always love our names, and being that we have audience members that are not all Nigerians, I wanted to be able to also talk about our culture, right? In the sense where we get to give them a little bit more insights as to these names that we have. They may be, sometimes they are scared to be able to pronounce our names, but
Right.
where the meanings of the names that we have, then you really should be proud to be able to, even if you mess it up, it's okay.
Yes,
But
I agree.
there's value behind those names. So
Mm-hmm.
don't be scared to be able to pronounce our name. But Funsho for short is pretty sweet. So
Mm-hmm.
you all will hear me maybe throughout the episode call her Funsho, but really I should be calling her Dr. Funsho because
No.
she is someone that comes with some credentials to this show. So
No, we can skip the formality.
all righty.
I'm
So
fine.
Funsho, if you don't mind, tell us
Mhm,
about yourself, because I know you.
mhm,
I'm sure there's some things I don't know. I don't know everything, but I know you pretty well because we're pretty close. But
mhm.
at least my audience doesn't know who you are. So it'll be nice if you can share with them about yourself, your family structure, how you grew up.
Mhm,
Also, most importantly, why this career in
mhm,
dentistry? What drove you to this passion or
mhm.
this profession that I think is your passion as well. So,
Okay, so yes, about my personal life, a little bit about my personal life. I grew up the second of four children. There are two boys and two girls. I'm the first girl. I grew up in a city in Nigeria called Benin City. I attended high school, what we call secondary school there, and that's where Ogechi and I first met. And then, yes, so my family were pretty close. How I decided on dentistry as a career, I wasn't sure. I know I vacillated between professions like most of us, career options, I'm sorry, like most of us might have done, from wanting to sell ice cream when I was maybe like 5 or 6,
mm-hmm.
because I've always had a sweet tooth. And I thought if I sold ice cream, I would have enough ice cream for myself, but I was being silly. But anyway, as I grew up, I wasn't sure. And at some point, I thought, okay, I want a career in health because my dad was a doctor. But then I wasn't sure I wanted to be a medical doctor because Sometimes we would wake up in the morning and my mom would say, "Oh, be quiet. Daddy was called out in the night. He had a call or there was an emergency." That part I didn't really like. Um, and then so I still kept thinking about it. And then at some point I had what some people would refer to as buck teeth. And my cousins would tease me and make fun of me, and I always wanted to get my teeth straightened. But we didn't have an orthodontist in Benin at the time. Um, Eventually, my father got me to go to Lagos, where there was an orthodontist. So I would go to Lagos from time to time, and I would come back and I would regale my family about the dental school and how everybody looked nice and blah 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 blah. And one day I was talking, and my dad said, "Have you ever thought of dentistry?" And it was like light bulb. I was like,
Wow.
yes, yes. Add that to the fact that I had a sweet tooth, and I always talked about the dental school and everybody there, and then it also helped that I had a crush on one of the orthodontists that used, well, the orthodontist colleague who used to treat me. It just all seemed to
Oh,
add up.
of course, a crush has to come into
Yeah, I'm telling you, I had the biggest crush. And every time I went for my appointments, I would look forward to seeing this doctor who would just come and look at me and say, "Oh, hello, young lady." Anyway, I could go on and on, but I'll just keep it brief. That was the light bulb moment. And so even in secondary school, there were actually only two of us who wanted to do dentistry as a career. And most people were like, "Why won't you do medicine?" And I knew I wanted to do health, but I didn't want to, I felt I wanted to do something a little more focused, because I didn't want to go do the calls and all of that. But little did I know that there's a reason why dentistry takes the same number of years as medicine, because there's more to the mouth than we all realize. So that's my story in a nutshell, Ogechi.
Okay, great. So did you I know you talked about, with your dad
Mm-hmm.
being a doctor. I think that was also, led you to being in the healthcare sector, right? And then of
Correct.
course this dentistry school that you went to, plus the fact that you met somebody you had a crush, but everything plus your sweet tooth, everything, clicked.
Yes.
But where did you get your educational experience? I would say, to get you to the path of being able to really fulfill that desire of a dentist.
Okay, so as I mentioned, when my dad suggested the idea, it was like, honestly, it was like God sent him. And
Mm.
from the minute he said that, and I received it, I was on the path to dentistry. I applied to the University of Lagos to study dentistry. If you schooled in Nigeria, you know that you had to do this examination called the JAM examination, and then you had to pass the relevant subjects for your senior secondary school or school cert or whatever it is called in what country you grew up in. Um, and so yes, I applied to do dentistry. I was taken for dentistry in University of Lagos at the University of Lagos School of Dentistry. So I started off there. And then we went to dental school. If you schooled in Nigeria at the time I schooled in Nigeria with the federal universities, you'll realize that there's always the problem with the lecturers and them always wanting, not always, but they just seemed to be unfairly treated at the time. So there were a few
Mm.
strikes along the way. Most of us had our university education extended, due to no fault of ours, just because they would go on strike and all of that. So at some point during my education, although I liked it, I kind of got frustrated, because I was like, you're in school, this thing is getting prolonged. And so I thought,
Mm-hmm.
when I graduate, maybe I shouldn't do dentistry anymore. Maybe I should do public health.
Okay.
Um, so I say that to say I veered away a little bit. So when I graduated, I did my house job as was required. In some countries, they call it internship.
Mm-hmm.
I did my house job as was required by my country after you graduate, and then you do your national youth service. And then I left the country. I left Nigeria to the UK to study public health.
Okay.
got a master's in public health, and then I worked in public health for about a year and a half. And
Okay.
that was all it took to make me realize I didn't, and really, I mean, I liked public health, but I missed the human interaction and just dentistry. Um, so I went back into dentistry. I had to do some qualifying exams to be able to practice as a dentist in the UK. I did some qualifying exams. I did some further studying. And then I started working in the UK as a general dentist.
Okay.
And then I worked in the NHS sector in the UK for about 8 years as a dentist. And because, I mean, the dentistry in the UK has faced some challenges. Generally, healthcare in the UK has faced a lot of challenges. And so at some point, um, practicing as a dentist became a little less fulfilling for me because of all the hoops that you had to go through to practice. And because I knew I was still passionate about dentistry, um, I started praying as to what my next
Path would be.
path. Thank you so much. My next
Mm-hmm.
path would be, because I knew it wasn't fulfilling anymore, dentistry in the UK. And somehow things aligned, things happened that drew me to the US. And I came to the US. I had to go back to dental school in the US for 2.5 years at the University of Minnesota. I did that for 2.5 years. And then I started to practice. That is the long story, the long response to your short question, Ogechi.
Oh, that's okay. I mean, but the reason I ask those questions because I want people to know you have the experience, you have
Mm-hmm.
the educational background. I'm not just talking to just anybody, right? I'm talking to someone who has some experience and
Correct.
education in this. So I appreciate you taking the time to explain your journey and your experience as to how you got to the US, right?
Okay.
So thank you so much for that. So let's get into the real reason why we're here, right? Which is
Mm-hmm.
to give a good overview on dental health. For me, I've always, growing up in Nigeria, I mean, I can't really talk. I don't even remember actually seeing a dentist, really.
Mm.
Um, we just know that we grew up not eating a lot of sweet stuff, At
Mm-hmm.
least from my experience, my mother really didn't like us having candy and all that stuff. Well, every once in a while, but it was not like a regular thing.
Mm-hmm.
And even though my dad would sneak some of those candy treats from time to time, but it was not something that was a regular thing that
Right.
I would get. I remember
Mm-hmm.
traveling with my mom to the States to visit her brother at some point, and he would always ask me what I wanted, and I would eat so much candy to the point where I had a stomach upset. But that's
Mm-hmm.
just when you haven't had something for so long, when somebody gives it to you, just act. We tend to act a fool, with it.
Tell me about it.
So I guess my long way of getting to that story is, or where I'm trying to get to is, I didn't grow up going to the dentist in Nigeria.
Mm-hmm.
Relocated to the States to go to college and all that good stuff. Started working. Then there was the need to be able to go to a dentist, right?
Mm-hmm. Mm-hmm.
And then from there, had my wisdom tooth and all that good stuff. But just from my years of dentist, I
Mm-hmm.
realized the importance of checking your mouth, making sure your
Right.
teeth are healthy, because if your
Right.
teeth is not healthy, most likely your body is not healthy. And I
Correct.
think that's what I'm really trying to get across to people is, we go to see primary care physicians. If we have any specialty issues going on, you go to see those individuals. But
Mm-hmm.
most Nigerian Americans, or just Nigerians, don't make dental health a
Mm-hmm.
priority, right?
Mm-hmm.
And so mm, uh, I'm leading to the question of, why is dental health important, and what should people know about why it's important?
Okay, so you raised a good point when you said people didn't go to the dentist. You weren't raised
Mm-hmm.
um, going for routine dental checkups, and I think, and it's not just you. A majority of people in the developing world, are not raised with that awareness, simply because in the grand scheme of things, going to see the dentist is sort of lower down on the list of needs or things you need to fulfill. You Similarly, some people won't go to the doctor unless there's a problem, because I
Yeah.
mean, why go if there's a problem? So I think the main reason would be the lack of awareness. And then some people just like to live in blissful ignorance. What you don't know doesn't kill you, so just don't go. But over time, so when we see them, so even when I went to dental school, we mostly saw patients that were at the end of disease, where we couldn't do anything. We had to take out teeth, or we had to do major surgery because they had tumors and things, or diseases that had started small but weren't identified. They would just think, okay, well, just take this, take that, over the counter things. And by the time they were coming, it was end stage, so, or close to terminal, for things that were terminal. So that would be one reason. But like you so rightly have pointed out, when you know better, you do better.
Yeah.
There's things called oral manifestations of systemic diseases, in the sense that there's some diseases that you first see orally before you see them systemically.
Wow.
And just as a quick mention, for instance, just the having an ulcer. Some people think, oh, it's just an ulcer, and sometimes it might be pointing out to deeper things, like anemia, like thyroid problems, like heart problems, like kidney problems, and things like that. And so you first, depending on the presentation, you first see it in the mouth. There's some congenital anomalies or some infections that you see first in the mouth, just with the way the way it manifests orally. And these are things that you want to get diagnosed in time. There are bacterial infections that have been linked to heart disease.
Yes.
So these are some of the many reasons that you want to go to get checked up in time. Because the truth about it is, when you catch things pretty early, then treating them is more predictable, is less stressful. Some people also don't go to the dentist because they're afraid.
Yeah.
I remember my friend was studying for an exam. This was several years ago. And he says, Funsho, do you know the profession with one of the highest suicide rates is the dental profession? I was like, say what now? And he goes, it's true. And they postulated a few reasons for that being the case. I mean, I love my job, so I'm thinking, how are people committing suicide? And one of the reasons was because people hate to go to the dentist for whatever reason. Some people associate the dentist with pain, so the dentistry has become synonymous with pain. But then we have come such a long way. So I tell people, when you're treating something in the earlier stages, it's next to painless, it's predictable. Now we have better things to work with. So don't fear the dentist. And many times when we pick up things in the oral cavity and we treat them, so if it's, say, a systemic disease manifesting orally and we notice it, we can treat it, especially when we get it in its infancy, we can treat it with a lot more predictability than when it's well advanced. I know I've said a lot, Ogechi, but this is just to give the audience a very brief overview of why dentistry is important.
Yes. Absolutely right. And at least from my experience, it's not even just folks in the developing world that don't see the value of dental care, right? It's even folks in the developing world.
Yes,
Did I say that right?
you
Basically, the
said that
folks in the
right.
non-developing world are not the only ones who, at least they're, in their case, they don't. In some cases, they don't have money, they don't have access, they don't have awareness. But in the developing world, like in the West, right? I also see the same thing, where you have people who still don't want to go to a dentist just because of fear, just because, and to the things that you've mentioned, right? They think, oh, they're going to put something in my mouth and it's going to be scary and all of that good stuff. But as you mentioned, it's just as important to take care of your mouth
like you take care of every part of your body, right? I would
Correct.
always say your dental care is important, your physical care is important, your mental care is important. I mean, the list goes
Correct.
on and on. There are reasons why we have these professionals, and the sooner you want to go sooner to see them for just routine maintenance stuff,
Mm-hmm.
right?
Mm-hmm.
That you have to do every year.
Right.
Prime example would be just cleaning of your teeth. Just
Mm-hmm.
being able to clean your teeth, right, would start that journey towards you guys being able to see stuff. Can you talk a little bit about what exactly do they need to do from a maintenance perspective to take care of their dental health?
Okay. Sorry. Let me quickly go back to clarify my previous response. You're correct. When I started answering the question, I started answering the question from my where I started dentistry, so from Nigeria. But
Yes.
I
Yeah.
ended up answering the question as I have seen dentistry and people's behavior, even to my moving to the UK and my moving to the US. Ogechi, you're correct when you say people don't go for several reasons. I've worked in 3 different continents, and it's about the same. People don't go because they're afraid. They think, oh my God, I wouldn't, it's expensive. Even in the UK where it costs next to nothing, we still had people coming only at the end stages. So, yes, thank you. My response spanned my
Your
entire
experience.
dental
Yeah.
experience. So,
Yeah.
just wanted to clarify that. And then to answer the next question, how does one start from a preventative point of view? It's Ogechi, I like the fact that you said from a preventative point of view, because that is the best place to start early. I like how you talked about going for your routine cleans. The bacteria in the mouth, we all have bacteria in our mouths. But the interesting thing about the bacteria in our mouths is that they can be very stubborn, especially the bad bacteria. And we feed them with enough stuff. So every time we're eating things that are remotely nice tasting, that means they have sugars in them. That means we're making the bad bacteria happy. The happier they get, the more they adhere to our teeth structure. So they adhere to the teeth, they adhere to the gums, and they can be very stubborn, recalcitrant to treatment, meaning you can't just brush it off. And
Mm.
once they are there, then they start causing all kinds of things. So just going for, say, let me go for a checkup first of all. If you haven't been to the dentist, go for a checkup. They'll take x-rays, they'll do gum measurements, we'll do imaging, we'll do all kinds of things, and then we'll start. If you are blessed enough to have, some people just are blessed with just being able to get away with doing basic things like brushing their teeth, flossing, mouthwash, and they come in, and good genetics, they come in and we're like, wow, you haven't been to the dentist in this amount of time, and things are pretty not bad. I don't want to say it different.
Mm-hmm.
So just getting them in, taking x-rays, cleaning the hardened bacteria that has encased itself in shells, because that's what we call calculus. There's some things that only the dental hygienist can clean out to help
Mm-hmm.
maintain a healthy oral environment, therefore a healthier heart, a healthy system. And then depending on what the dentist sees during their examination of you, they'll put you on a recall schedule. Averagely it's every 6 months, but some people we
Mm-hmm.
need to see more frequently, some people maybe less frequently, but not really.
Mm-hmm.
Because as we know, bacteria and it's not just bacteria that affects the mouth. There's funguses that affect the mouth, there's viruses, but we want to catch them at an early stage. So that's why we put you on. We want to see you at least, if your dentist says it's okay, at least twice a year.
Mm-hmm.
And at that appointment, that's when you do what we call a prophy or a clean or whatever it is referred to in your part of the world. That's when the dentist does an exam. That's when they do some other checks, head and neck exams and stuff like that. And sometimes some imaging and some things, just to make sure that there's nothing sinister or nothing happening that shouldn't be happening.
Okay, good, good. I mean, I know also some of these routines, right, also depends on what type of insurance coverage you have, especially for those of
Correct.
us in this country, in America, where some insurance companies offer twice a year, some offer it, you know, less so,
Less frequently.
less frequently. So I say that to say also pay attention to what your insurance coverage offers as well.
Right.
And that way, also talk with your dentist to figure out what will work best for you,
Right.
right? So
At this juncture, Ogechi, can I say something, please?
you sure can, please.
I've noticed, because insurance, if we think about insurance for those who live in North America, where most of your dental treatment, medical treatment is covered by insurance. And I'm going to use the word dictated.
Mm-hmm.
As we know, and I won't make this blanket statement. Insurances do not want to pay out for treatments if they can. But I want to advise people, do not let your insurance dictate your treatment. Let your doctor, your dentist, whoever dictate your treatment, because that always is an issue. So we'll have patients come in who need a certain kind of treatment, and they're like, oh, my insurance doesn't cover that. My insurance only covers this. And we're like, we don't go by insurance diagnosis. We go by our own diagnosis, what we're seeing.
Makes
And
sense.
some people will buy, depending on what your office, your organization offers or what you can afford. You buy insurance for what you can afford, not what you need. So please bear that in mind. Don't let insurance dictate your treatment. Your healthcare professional knows what you need. And so, they're in a better position to tell you what's best for you.
Correct. I totally agree with that 150%, if not more. Because the message you're basically getting at is focus on your care, right?
Absolutely.
Make your care be the priority, and then everything else will work itself out one way or the other, right?
Thank you. I couldn't have said it better, girlfriend.
Make your care be your priority. Okay.
Mm-hmm.
So I know I see a lot of ads on TV, or there's, all these innovative ways of looking at dental care differently, right? We have what we call these black toothbrushes, because we that grew up in Africa, we have what we call these chewing sticks that people use in brushing their teeth. Then you have a version of that who is not coming out like these your black toothbrushes or something. And then you have all these electronic toothbrushes as well. Then there are all these other gadgets. What do we really need to take care of our teeth every single day? Do we have to really invest in all these things, or what are the main things that we need to keep our dental care to maintain a healthy dental care?
It's really funny, and I'm sure most people realize that a lot of these things on TV are just sales gimmicks. So they'll tell you charcoal toothpaste, they'll tell you black toothbrush, whatever it is you see. The most important thing is you want to keep your mouth clean. And so do it the best way you can. It doesn't matter if the toothbrush is purple, pink, and blue. There are just certain things. When you go to your dentist, depending on what they see, sometimes because of your dental structure, you need a certain form of toothbrush or water floss or go-betweens, like they're called, to help clean your mouth better. But basically, what you should remember is bacteria is housed in something called plaque. And that's the sticky stuff that stays on your teeth that eventually will get hard if it's not cleaned adequately. And even when you clean it adequately, sometimes it will get hard and go under your gums and you can't brush it out. So what you're focusing on is removing that plaque film. So the most important thing is getting a toothbrush. The toothbrush helps to clean away that plaque film. I liken it to when you have a dish, dirty dishes. You have a sponge to wipe away the grime and the filth on the dish. Now, what makes it easier to do that? You use dish liquid, just like you use toothpaste. A toothpaste that contains fluoride. Now, that's a whole different conversation that maybe Ogechi will have, because there's schools of thought about fluoride and all these things. Fluoride is safe for most of the population. We'll talk about that later, and I'll tell you why. But why you want the toothpaste is because, number one, it will have fluoride that will help strengthen your teeth. It's like you can liken it, like I said, to the dishwashing liquid. This it helps make cleaning easier and it helps remove the plaque better, and it also helps to make the bacteria not as active. I could explain that later. So that's one thing. Now, the electric toothbrush, why, if you can afford an electric toothbrush, it'd be a good idea to get an electric toothbrush is, and I liken it to driving a stick versus driving an automatic car.
Makes
The electric toothbrush is rotating so many oscillations per minute. It just makes cleaning a lot easier, as opposed to with your manual toothbrush. Now, some people are good with manual toothbrushes. I have patients I see, and I'm like, wow, so more grease to your elbows if you can use a manual toothbrush to get rid of all that plaque and all of that. Very well, good for you. But getting an electric toothbrush to make your life easier, I ain't gonna hate you.
As long as it does the job, right?
It does the job. I held off before I got an electric toothbrush. Now, when I got an electric toothbrush, because we get these things just by the companies and all of that, I was like, why did I wait so long, Funsho? Why? Because I just realized that it kept plaque off my teeth longer.
Wow.
Because I without going into too much detail. So yes, keeping it simple, using mouthwash in between, because mouthwash contains, and you don't have to buy a high-end mouthwash. Like I said, a lot of them are sales gimmicks. You're buying the brand name rather than the effect, the efficacy of the mouthwash. Just getting one that contains fluoride, that says that it's an antibacterial. Make sure you're not allergic to anything in it. Yeah. And then if you have sensitive teeth, get something for sensitive teeth. But that's a conversation for a different day, for a different podcast.
Okay. So how often should we change our toothbrushes?
Okay, so you'll hear people say change your toothbrushes every 3 months. But the caveat is change your toothbrushes as soon as you notice the bristles have started splaying. You want to change your toothbrush. If you've had a cold or any kind of head and neck infection, sinus infection, you want to change your toothbrushes, because bacteria stays and will linger on your toothbrushes. So that's like the safe guide, keeping it simple.
Wow. You see, I've learned something new today, because I didn't know anything about the cold or the flu.
Right.
But that makes perfect sense. Because that is also a form of infection sometimes, at least for me, when I get them. Okay. Oh, wow. Okay. So you've basically talked about how, because my next question was going to be about how to optimize, one's dental health, and which you've really done a great job of summarizing and keeping it simple to the audience. So for those folks who don't have health insurance, right? Because my goal is to be able to not just help everybody. Is one of the goals of this podcast. Is for those who have the resources, yes. For those who don't, they still get something out of this conversation to be able to help them. So for those who don't have access to dental care and things of that nature, how can they get the support that they need when they need it, so that they don't wait till things get really, really bad, right? So what ideas or thoughts do you have around that, besides just the toothbrushing, the mouth floss, the toothpaste? What else can they do to be able to at least get access to some care?
A good question. Depending on the country where you live, there's always dental schools, hygiene schools, where they're looking for students to practice on. Those are a very good resource. If you live in Nigeria, looking for a dental school close to you or hygiene school would be your first point of access. Another part, if you lived in the UK, for instance, for most part of it, dental care is pretty free. Especially if you're a new mom, or I'm not sure if they've extended that to fathers. If you're on income support, if your salary bracket is below a certain threshold, you have access to free care. And then there are free clinics, there are universities and hospitals that will give you some basic kind of care. If you live in Northern America, there's community clinics. All you need to do is Google free clinics. In almost every state in the US, they have those free clinics. They have a dental school, they have hygiene schools, they have dental therapy schools, places where they will see you assess your oral health and be able to point you in the right direction. I would say the internet is a very good source. Now,
Yeah.
Ogechi is going to leave my details, or she's going to leave my details somewhere. If you're in doubt, if you need questions, if you need to be pointed in the right directions, please don't hesitate to reach out to me. Chances are, I know I have colleagues in some part of the world that can help with the information you need.
Awesome. You are the best. You are the best.
Thank
Um,
you. So are you.
so really we're getting to the end of this podcast, and I really want to say a big thank you to you, Funsho, for taking the time to be able to give us these words of wisdom, information, just guidance to be able to help our audience in helping in ensuring that they manage um, just the basic stuff when it comes to their their dental care,
Mm-hmm.
right? The
Mm-hmm.
goal is not to the point that you kept emphasizing or what I kept hearing. The goal is not to wait till it's too late, right? The goal
Correct.
is to be able to manage as much of the preventative health aspect of your dental care sooner, or at least get your cleanings done twice
Yeah.
a year. You
Mm-hmm.
know, talk with your dental clinic to be able to help support you through your journey, but at
Mm-hmm.
least have those preventative measures in place, just like you get a mammogram done every year or every 2 years, depending on
Mm-hmm.
your age group and all that good stuff. You do
Mm-hmm.
what you need to do with your dental care, right?
Correct.
Every year to be able to ensure you don't get to an end stage where it's really, really bad and there's nothing that can be done at that point, right?
Correct.
And really, and that was the goal of today's podcast, is just to be able to share why dental care is important, the
Mm-hmm.
value of it to your body and to your health. I mean, you mentioned the health, the heart aspect, right? As an
Mm-hmm.
example, the infections that people get, and sometimes it's it's a prerequisite of other things that could be going on in your body. So
Exactly.
take care of your dental care. And
Mm-hmm.
so, audience, what I'll do is I will, in the description box of this podcast, I would provide Dr. Funsho's information. But basically, for those in the Virginia, D.C. area, you have the luxury of being able to um, get to her. Her telephone number is 703-542-3171, and that's for the dental um, facility that she's in. And it again is called, can you do
Night
that?
bow.
Thank you. Nibar Dental South
Yeah.
Riding.com. So you can go to their website. And for those of you who don't have insurance, like she mentioned, you can access Google for that information. There are a lot of clinics.
Mm-hmm.
For those of you in Nigeria, you can go to, hygiene school or dental schools. They'll be there to be able to guide and support you at a discounted cost.
Mm-hmm.
Maybe in some cases, no cost at all.
Exactly.
Please go to them and talk to them. For those of you in the UK, you have access,
Yeah.
right? Whether you have the resources, you don't
Yeah,
have the
most people.
resources, you have
Mm-hmm.
access. And the same goes here. So wherever you are, just at least go online in the world and see what your country offers and take advantage of it. But again, Dr. Funsho, I just want to say big thank you for
Thank
your
you.
time. And I appreciate the feedback or the information that you shared today. And so thank you so very much.
The pleasure was mine, Ogechi. Thank you so much for having me and giving me the opportunity to educate people a little on dental health.
Thank you. All righty. Bye bye, guys.